Coming up next on the Jeff Crilley Show, hospitals are built for sick people. We're going to talk to a physician who changed her life by helping people heal their mind, body, and spirit. That's next.
Many are predicting that the worst is yet to come, which is unfortunate, said one person here. Until now, they've enjoyed the reputation of being the nation's icebox.
Watched a burglar in his home this morning by webcam.
As a journalist of over 25 years, stories are what make my world turn.
Reporting live from the Dallas newsroom tonight, Jeff Crilley, Fox 4 News.
But in 2008, I took the jump from my familiar life and started a PR firm from my home.
We're talking about anyone with a camcorder like the one I'm using becomes a television network.
We started slowly growing the company, and we now have over 100 clients, and we've branched into the world of live digital broadcasting. I now own 8 different TV studios and have a huge team, and the stories that I now get to share are sometimes the most important of my life. Life has a funny way of coming around full circle. This is the Jeff Crilley Show.
All right, if there's a criticism of medical school, it's they're teaching you how to write a prescription. They're not teaching you wellness. And if we can keep you out of the hospital, that's ideal. Dr. Remina Panjwani is in the studio. She's a board-certified physician, functional medicine specialist. Thanks for coming on the show.
Thank you for having me here.
Very cool. Well, we were talking before the show that, you kind of went down the hospital path for a while, but you yourself were suffering from burnout.
Yes, that's the big gap in our system is it's reactive, it's a bandage approach. And what do we do with burnout? We're not trained in what burnout is in medical school or in training. You experience it and then you realize it when it's too late. And that's when you start looking for tools that are actually going to help you.
And you started your practice when?
I would say it was during COVID, that's when I noticed the big gap. There was such a big gap in the system and burnout was being experienced everywhere with all healthcare workers. I launched my practice after I got certified in functional medicine shortly after, and I've been practicing since.
Okay, explain functional medicine, because people hear it, they don't understand it.
So the best way to compare is with conventional medicine, you go to your doctor, whether it's your primary care doctor in the conventional sense, or if you're in the hospital, and you're getting protocol medicine, you're getting more medications, you're getting bandages, and eventually what that system does, yes, it's good to help put bandages on acute situations, like if you have chest pain, having a heart attack or a stroke, but there's so much more that goes beyond that, before that happens. And it's not the same for everyone. So your textbook conventional medicine doctor will give you medicine to treat high blood pressure or diabetes, but they don't tell you what else. What are the lifestyle factors? What's going on in the rest of your life? What are the other tools? Functional medicine takes a larger approach to a broader approach. You get additional tools, a different perspective. So not only do you look at what your environment looks like, what's going on internally, what is your sleep, your nutrition, your exercise, looking at stress, all those other factors, and then looking at additional lab work, not just your regular lab work that you go get a regular blood level and it says everything looks normal. You look deeper at advanced biomarkers that are specific to you. So it gives you a whole picture and it gives you an advanced jump on what's personalized medicine, not just conventional. And it truly keeps you healthier longer. That's what people want, is to have longevity and quality of life. So you can pick up the groceries as you age. So you can look at your grandkids so you could show up and be functional.
Mm. We're going to pull up your website. As we scroll on your website, I'm sure you have success stories where somebody's on a cocktail of different medicines and then you slowly get them off of these different medications because you're dealing with the root causes.
Absolutely, yes. I would say a lot of my clientele, they're high performers, and so they are used to performing just constantly on it. The people say, let's just grit, grind it out, but really that's what leads you to burnout, and symptoms show up differently. So a lot of people that come to me, they're mostly women, and they're coming to me with anxiety, hormonal imbalances, gut issues, or just their system is completely off and they need to put it together. So yes, I look at everything. They'll come to me. Some of them will say, I've been to so many doctors and I just can't get answers. Or, hey, I want to stick around. I want to be optimal. Let's come up with a plan. So if you're on medicine, we look at what's needed, what's the root cause, what's not, try to de-prescribe or get you on a minimal amount. I had a client that came to me, perimenopausal, and she was doing everything, taking care of kids, trying to be an entrepreneur, all the hats that we wear. So I looked at everything that works with her, because if you overwhelm someone with all the options, it's not going to work for them. So that's the skill, that's the tool is, yes, there's all these advanced things you could do. There's biohacks, there's advanced testing, but really taking a step back and breaking it down, that's the beauty of it. It's really understanding the story. What does a every day look like for you? What is going on? What are your pain points? Let's work through it. And that's exactly what I do. One of my clients that comes to mind is we had to learn how to slow down. And while we're looking at the lifestyle prescription, slowing down, how are you eating? What stress management are you looking at?
Yes.
And then, of course, checking, for instance, hormones. And that's the beauty of it. Where you look at functional medicine, you're looking at exact breakdown of what's going on in your body, not just a snippet of blood work that's done typically in a conventional route. So, yeah.
You wrote an amazing book. Let's go ahead and put the book cover on the screen. Odd Girl Out, Doctor Within. Tell us about this book.
Yeah, so it's part memoir, lessons, and adding tools that people can apply. Many people, by looking at me, can't tell that I'm an Air Force veteran. So parts of that story, that's where a lot of my insights came during that time, and resources to get through the next step. So we all go through portions of our lives that may be hardships, but they're lessons, and they shape who we are today. So I go through, the main thing is everybody wants to live longer, right? Quality of life. So I give you the tools, mind, body, spirit, science-backed tools and experience. And it's all in the book.
All right, let's talk about your journey, because as a physician suffering burnout herself, I mean, you know all of the root causes, but you found yourself in that kind of downward spiral.
Yes.
How did that happen?
Yes, and sometimes it's too late. We hear oftentimes healthcare workers and military suffer with a lot of anxiety and depression and burnout, and eventually it ends with suicide. So before you get there, what are the signs, right? So burnout can look different for everyone, and someone that is a high performer can look normal on the outside and keep functioning because they have to perform, right? But what does that look like? Slowly, your energy does decline. You're getting brain fog. You can't focus. Your gut's off. Hormones are off. You start getting sick more often. You're inflamed. Your immune system is off. So eventually, you'll start noticing that you can't perform at your level anymore. And so for me, I started having a lot of anxiety, panic attacks. And I didn't know where they were coming from until I really took a deep dive and I utilized these tools and slowed down, because that's what people need. It's not continuously getting to the next step, getting to the next step. It's really letting your nervous system, your body balance and reset. And that's where your next level is. And that's how you prevent burnout, is tuning into yourself, doing all these, there's so much data out there. It's all simple. It doesn't need to be the biohacks. Yeah. Those are great too, but if you go for every biohack, it's a stimulation. So you have to get back to regulating yourself. And that's what I did. I took time to learning breath work. There's so much science on breath work, yoga, meditation, mindfulness, gratitude practices. It rewires your brain, right? The science of neuroplasticity. And then looking at how you sleep, how you eat, and getting the stress management and having healthy relationships that support you. So going back to the basics and then building upon that, because that's your anchor. And that's what I did that's how I found myself back in performing, and now I get to help other people.
Mm-hmm. Let's talk about, you mentioned sleep. So many Americans will go to sleep at a normal bedtime, but then they wake up at 3 a.m. and they can't get back to sleep. What causes that? Oh,
there's so many factors, right? Are you scrolling, doom scrolling, right? Everybody wants to look at TikTok or whatever the latest thing out there is. That's disrupting your brain. It needs to rest. There's a portion of your brain that needs actual rest, not stimulation. That's one. And if you're perimenopausal or menopausal, those 3 a.m. wake ups, that's a hormone shift. And that goes with mood. So getting to root cause and understanding what that is, or even stress. Or is your stress off? And that's imbalancing your chemical messengers, your neurotransmitters, your hormones. So it really depends on what your root cause is and addressing that.
All right, when you were having your panic attacks, would you wake up in the middle of the night and couldn't go back to sleep? Or like, what were you dealing with?
Mine was actually in undergrad. It was after the military. So imagine you have how you're raised, what environment you're in, and then being in a war zone. And if you suppress those things, they come out. And that's part of getting the root cause of anxiety and burnout, because eventually it does burn you out. What does that do, right? You have micro traumas or experiences, and your body doesn't really know the difference between emotional, physiological, psychological, biological. It all produces the same stress cortisol response. So imagine if you're constantly in fight or flight, you can't do the rest and digest, which is everything functioning to have your hormones, to brain fog, your hair falling out, everything, right? So for me, I had to figure out where that root cause was with those tools. And I had to go through the system. In undergrad, it showed up randomly, like maybe after a test, and I was there was all the thoughts, right? Those are the things you spiral, but you have to be cognizant and mindful and figure out where your loop is to cut that loop off.
Yes.
So for me, it's like, okay, well, I have to make it into medical school. I have to break the cycle of not being enough, because my parents came to this country to build a life for my family and me. So there was a lot of pressure I was building up on myself, right? So those things showed up, and then add in war zone, all that. So I was quite disappointed in the conventional system, right? All they wanted to do was, during that time, mental health wasn't really talked about. It was conventional medicine. It's all in your head. Your labs look normal. You're a college student. You're a woman. Deal with it, right?
Right.
So I went beyond, and it was actually on campus. This was at UT Austin, which was amazing. At UT Austin, there was a yoga instructor who trained in ancient yoga, meditation practice and all, and now modern medicine science is showing the research that shows is beneficial. So I started breathing. I started practicing mindfulness, and that's honestly what got me through, and I use it till today. And I implement these practices out here in the community and my clients as well.
Yes, we have about 2 minutes left, so look into the camera on the left, and the pulpit is yours. Talk to that person who's wired and tired, and know that their body's, not acting the way it should.
The greatest insight and advocate is you. So right now, health is wealth. It really is. And if your body is giving you signs and signals and symptoms, listen before it's too late, because eventually your body will shut down and force you. So if we're looking at health really is wealth, put in that time now, because that's how you perform. That's how you show up and wear the hats to help change the trajectory of your family, show up for your family, for whoever your clients are. And that's what's going to be mattering to you. It's you. Otherwise, eventually it shows up at the last decade of your life. So you don't want to do that.
Beautiful. We're going to end with your website, which is drremina.com. Dr. Remina, thanks for sharing your heart and your wisdom with us.
Thank you for having me.
That's it for now. We'll see you next time.